Hello, hello, everybody. Andrea Majewski here with Dentalelle Mobile Hygiene. Let's talk about, do your teeth hurt after you have your teeth cleaned? So I've been seeing a lot of patients this week where actually most of them contacted me first, called me up, sent me a message and said, okay, I've heard about you. I would like to see you, but my teeth are always in pain after I have my teeth cleaned. Can you help me? And I do tell them actually there are ways around that. And I don't want to promise you, but I can assure you that you will not be in pain after you have your teeth cleaned or while you have your teeth cleaned. And in the video today, I'm going to explain what some of the causes could be why your teeth were sensitive or in pain during a teeth cleaning previously, and what I do to prevent that pain or sensitivity from coming back when I clean your teeth. So that's what I'm going to talk about today, because there is a way where you don't have to be in pain from a cleaning. So I'm actually going to stop sharing my screen right now because I'm going to show you guys a couple images here on my iPad. So, and if you guys have any questions or comments, be sure to comment below because I might leave something out. I might leave out a common question, so please just let me know. But basically, you don't have to be in pain during a cleaning. If you're that person where you would have your teeth cleaned and you would have to get local anesthetic to have your teeth cleaned, that could be because several reasons. So not just because your teeth are in pain or you're sensitive, it could be because it's been 20 years since you had your teeth cleaned last and you just had that much tartar, plaque, stain buildup on the teeth. So we kind of look at that in a dental office and say, this is probably going to cause you pain. I'm going to give you local anesthetic first to numb the area so we can get in there, dig deep underneath to clean the teeth. So if your teeth kind of looked like this, okay, you guys, so I know, whoops, not like that. I know, lovely picture as I just lost it. There we go. Sorry, guys. So I just took this off of the internet. So let me just kind of bring it up really, really quickly here, as straight as possible. There we go. So if your teeth look like this, you have probably been in pain before at your teeth cleaning. So I'm just going to kind of point that out with my pen. So see those kind of brown areas? Okay, it's harder than it looks to hold this with one hand. So see those brown areas and yellow areas? Those are, plaque, tartar, stains. So that's not your actual tooth. Once all of that is taken away, your teeth will look amazing and really, really nice. But I have ways, so even if I clean off that, you won't be in pain. And I'll tell you what that is. It's basically me taking my time, as silly as that sounds. I don't do a full cleaning in 1 hour if your teeth look like that. I will probably do cleaning above the gum line for 1 hour or a certain area and then come back next time and do the rest. So what's changing from the first visit to the second visit is I will probably talk to you about using a different toothpaste. I will likely put on what's called a desensitizer, so not a needle, not any numbing agents, but what's called a desensitizer on those areas or any areas that I see that could be causing you the sensitivity, and that will actually help to heal up that area for you and bring back those crystals in the teeth that have been lost in the first place, because you are likely sensitive because the tooth in some way is going to be exposed and it's not used to that. Your teeth have minerals, all that good stuff in there. So if those minerals aren't there anymore, either because they've been covered up with plaque, tartar, stain, if you've been eating a lot of acidic type foods, pop, coffee, tea, anything that's on the acidic side, it's taking away those minerals constantly. Every time you are eating something or drinking something that's acidic, that acid attack, we like to call it, is attacking those teeth in the mouth, basically for 20 minutes. So if you're having a Pepsi and you're sipping that Pepsi while watching a movie for 2 hours, or an hour, whatever, every sip means another acid attack. So when we come to you to clean your teeth, all of that acid has been sitting there and eating away at the teeth over time. Those minerals aren't on the teeth anymore. But there are toothpaste out there that can help to bring all of that good stuff back. So I'm actually just going to pop up another picture for you guys. Let's see here. So I use a combination of things, but I love this toothpaste. It is called Remin. This will actually bring all of that healthy tooth structure back over time. If you ever notice any white spots on the teeth or even brown spots in some cases, this toothpaste can help to remineralize that tooth to bring everything back. Once the tooth is becoming remineralized, that is when you get less sensitivity. But toothpaste obviously takes time, right? You are brushing 2 to 3 times a day, hopefully. You are not going to notice results overnight. You will over time, like a month, maybe even 2 months. But in the meantime, what I like to do on top of that is apply a desensitizer, which you probably heard me mentioned, called Crystal. So it comes in this, not that big, but that's how big the picture is. It comes in a little tube that I put on those areas where it looks like you have either thin enamel, if I can tell the enamel on that tooth has worn away. I apply it for about 60 seconds, 30 seconds, sometimes take it off, that's it. So it's so easy. It's a thin liquid that helps to work its magic to remineralize that tooth quicker. So this literally works right away. So this is something that I would apply for you when I see you. A toothpaste is something you will use on top of that at home. In some cases, if your teeth are that sensitive, then I will give you a preformed tray to put in your mouth and use the toothpaste in that tray overnight or for at least an hour a couple times every single day. So there's different methods we can do. So if you've been sensitive having your teeth cleaned in the past, this is your answer. Now, there are still patients that I see that say, well, I have always had local anesthetic. That's what works for me. That's what I want. That's okay too. But local anesthetic doesn't treat the problem. So I really like to actually treat the problem and go back and say, okay, how can we prevent this from happening again? How could this have been prevented in the first place? When a patient tells me their teeth are sensitive or they can't have their teeth cleaned because they're that sensitive, I don't just say, okay, well, let's give you a needle, some local anesthetic. This will numb the area, done and done. I say, okay, why is this patient sensitive? Because that's not ideal. That's not normal. Why are they in so much pain that they've had teeth cleanings before where it's taken them 10 years to come back because they were in that much pain? What's causing that pain? So we don't want to cover up the problem by giving you local anesthetic every single time. We want to actually fix that. So that's where, again, these things come in. Whoops, that is another video for another day. Sorry, guys. So the desensitizer I like to apply when I see you so that it does start to work right away within 30 seconds. It is quick. It is amazing. To keep that amazing desensitizing action, there will be a toothpaste that I will give you to use every single day, two to three times a day. There's another one too, which I didn't take a picture of, just kind of depending how your saliva level is in the mouth. But those are just the main ones for now. So you see how with proper oral hygiene tools, so toothpaste and desensitizers, that can really change things up. So you no longer have to say at every single cleaning, oh, just so you know, I'm going to be in pain, so go easy on me. I took an Advil before I came here because I know I'm going to be in pain. That's not ideal. That's not the norm. If you have to have a needle for a teeth cleaning, you guys, that's not the norm. There are other things we can do to help you. So let me know if you guys have any questions at all. I am so happy to help, and thank you so much for watching.